Have you ever looked at your underwear and wondered, why do I have discharge every single day? Or maybe you found yourself asking, is this normal or should I be worried? If so, you're definitely not alone. Vaginal discharge is one of the most common concerns women have, yet it's also one of the least talked about topics. Many women become worried when they notice discharge daily, assuming something must be wrong. The truth is that for most women, having vaginal discharge every day is completely normal, and actually a sign that the reproductive system is functioning properly. However, there are certain changes in discharge that can signal an infection or another health issue. In today's video, we're going to discuss why vaginal discharge happens, what normal discharge looks like, what abnormal discharge looks like, when you should see a healthcare provider, and how to support a healthy vaginal environment naturally. Let's get started. What is vaginal discharge? Vaginal discharge is fluid that is naturally produced by glands inside the vagina and cervix. This fluid serves several important functions. It helps clean the vagina, remove dead cells, remove bacteria, maintain moisture, protect against infection. Many people are surprised to learn that the vagina is actually self-cleaning. The body naturally produces discharge as part of this process. Without discharge, the vaginal tissues would become dry and more vulnerable to irritation and infection. In other words, discharge is not necessarily a problem. In many cases, it's a sign that your body is doing exactly what it's supposed to do. Is it normal to have discharge every day? The short answer is yes. Many healthy women experience vaginal discharge every day. Some women notice only a small amount. Others may notice enough to dampen their underwear or require a panty liner. Both situations can be completely normal. The amount of discharge a woman produces can vary depending on hormones, age, pregnancy, birth control use, sexual activity, overall health. There's no universal amount that every woman should have. What's most important is understanding what is normal for your own body. Why does discharge change throughout the month? One reason women become concerned is because discharge doesn't always look the same. Throughout your menstrual cycle, hormones fluctuate. These hormonal changes affect the amount and consistency of discharge. For example, around ovulation, many women notice discharge that looks similar to raw egg whites. It may be clear, stretchy, slippery. This type of discharge is completely normal and is often associated with fertility. After ovulation, discharge may become thicker, creamier, white, or cloudy. Before your period, discharge may become more noticeable due to hormone shifts. These changes are a natural part of the menstrual cycle. What does normal discharge look like? Normal discharge is usually clear, white, or slightly cloudy, thin, creamy, or stretchy, mild smelling, or odorless. It should not cause itching, burning, pain, or irritation. A slight yellow color after drying is often normal. Some variation from day to day is expected. Signs of abnormal discharge. While daily discharge is often normal, certain changes can indicate a problem. Pay attention if you notice a sudden change in color, odor, texture, amount. Some warning signs include strong, fishy odor. A fishy smell may be associated with bacterial vaginosis. This occurs when the balance of bacteria inside the vagina becomes disrupted. Thick, white cottage cheese-like discharge. This may indicate a yeast infection. Yeast infections are often accompanied by itching, burning, irritation, green, gray, or yellow-green discharge. These colors are generally not considered normal. They may be associated with infections that require medical treatment. Frothy or foamy discharge. Frothy discharge can sometimes be linked to certain sexually transmitted infections. Bloody discharge. Unexpected bleeding between periods should always be evaluated by a healthcare provider. Other symptoms you should never ignore. See a healthcare provider if discharge comes with vaginal itching, burning during urination, pelvic pain, pain during intimacy, fever, unusual bleeding, swelling, or redness. These symptoms may indicate an infection or another underlying condition. Common causes of abnormal discharge. Let's look at some of the most common causes. Yeast infections. Yeast infections occur when there's an overgrowth of Candida fungus. Symptoms may include thick white discharge, intense itching, redness, burning. Yeast infections are common and often treatable. Bacterial vaginosis. Bacterial vaginosis occurs when normal vaginal bacteria become imbalanced. Symptoms often include thin gray discharge, fishy odor, increased discharge. Sexually transmitted infections. Certain STIs may cause abnormal discharge. Examples include chlamydia, gonorrhea, trichomoniasis. These conditions require proper medical evaluation and treatment. Can stress affect vaginal discharge? Surprisingly, yes. Stress can affect hormones and immune function, leading to changes in vaginal discharge. Menstrual cycles, vaginal health. While stress doesn't directly cause every vaginal issue, it can contribute to imbalances that increase the risk of infections. That's one reason stress management is important for overall health. How to support healthy vaginal health. Naturally, many women wonder what they can do to maintain a healthy vaginal environment. Here are some simple habits that may help. Stay hydrated drinking. Enough water supports overall health and normal bodily functions. Wear breathable underwear. Cotton underwear allows airflow and may help reduce moisture buildup. Avoid douching. The vagina is self-cleaning. Douching can disrupt the natural balance of bacteria and increase the risk of infections. Use gentle products. Harsh soaps, fragrances, and scented sprays may cause irritation in some women. Choose gentle products whenever possible. Eat a balanced diet. A diet rich in fruits, vegetables, whole grains, lean proteins. Supports overall health, including vaginal health. Manage stress activities such as walking, meditation, deep breathing, exercise. May help support hormonal balance and overall well-being. When should you see a doctor? Don't ignore unusual symptoms. Consider seeing a healthcare provider if discharge changes suddenly. You develop itching or burning. You notice a strong odor. You experience pelvic pain. Symptoms persist or worsen. Early evaluation can help prevent minor issues from becoming more serious. So, is it normal to have discharge every day? For most women, the answer is absolutely yes. Daily vaginal discharge is often a healthy sign that the reproductive system is functioning properly. Normal discharge helps keep the vagina clean, lubricated, and protected. However, changes in color, odor, texture, or accompanying symptoms may indicate an infection or another health concern. The key is learning what is normal for your body and paying attention to changes. Remember, vaginal health is an important part of overall health, and the more informed you are, the more confident you can feel about understanding your body. If you found this video helpful, don't forget to like, subscribe, and turn on notifications so you never miss our latest women's health content. Thank you for watching, and we'll see you in the next video.